Hello students, today we are going to study about therapeutic nurse-patient relationship, which is come under mental health nursing unit 4. So we are going to start. First we are going to see the concept of therapeutic nurse-patient relationship. So it is a relationship is defined as a state of being related or a state of affinity between two individuals. The nurse and the client interact with each other in the healthcare system with the goal of assisting the client to use personal resources to meet his or her unique needs. Next, we are going to see the types of relationships. So there are three types of relationships. First one, social relationship, intimate relationships, therapeutic relationships. Now we are going to see one by one. First one, social relationship. So it is a relationships which is based on your surroundings, your society, what bonding you are sharing with your family members, your friends. That is the example of social relationships. Next we are going to see intimate relationships. So what is the meaning of intimate relationship? Is it is a relationship that occurs between two individuals who have an emotional commitment to each other. Example is husband wife relationships. Next we are going to see therapeutic relationships. So the therapeutic relationships between nurse and the patient, like it is based on the therapeutic purposes, based on the treatment. So what relationship a nurse and the patient shares, that is called as therapeutic relationships. Next we are going to study about the components of therapeutic relationships. So there are four components: rapport, empathy, warmth, and genuineness. So what is the rapport? Rapport is a relationship or communication, especially when useful or harmonious, and it is a willingness to become involved to another person. Next we are going to see what is empathy. Empathy is an ability to feel with the patient while retaining the ability to critically analyze the situation. Means we can give a emotional support or understanding to the patient. Next is warmth. Warmth is the ability to help the client feel cared and comfortable. It shows the acceptance of the client as a unique individuals. Next we are going to see the genuineness. Genuineness involves being one own self. This is the implies that the nurse is aware of their thoughts, feelings, values, and their relevance in the immediate interaction with the client. So these all are the components of therapeutic relationship. There are total 4. So our next topic is phases of therapeutic relationships. So there are 4 phases. First one is pre-interaction phase, second introductory or orientation phase, third one is working phase, and fourth one is termination phase. Now we will see in details one by one. The first one, interaction phase. This phase begins when the nurse is assigned to intimate a therapeutic relationship. So where we are going to start the planning for the interaction. It is a preparatory phase, so we have to plan for it. So what are the stars in the pre-interaction phase we have? So explore own feelings, fantasies, and fears. Analyze own professional strength and limitation. Gather data about the patient whenever possible. Plan for the first meeting with the patient. So problems and counters. If you are planning for the pre-interaction phase, what are the problems we can face? We can face difficulty in self-analysis, self-acceptance, anxiety, boredom, anger, indifference, and depression. Next, the phase is orientation phase. So in this phase, what we will do, we are going to meet the patient. So we are going to orient the patient. In this place, we are going to introduce ourselves and we are going to get the information from the patient. That is a first is orientation, orienting to each other. Next phase is working phase. So in the first pre-introduction phase means we have planned everything, setting timings. In the orientation we have introduced to each other. Now is the time for the working. We can start work on the problem or work on the issues the patient have. So that's why it is the third stage, or it is called as working phase. Whatever plan we have made in the first 2 pages, we are going to work on that, we are going to implement in the working phase. Next, here comes to the termination phase. So it is the last phase or end phase. So after finishing all the interaction or the implementation, here we are going to finish the process or program. So in that, what we are going to see, we are going to ask the patient to come for a follow-up or to see the effect whatever we have done in the working phase. So we'll ask the patient, you can come after 1 month for the follow-up. So we can see the improvement in the patient. So with this, we have finished the 4 phases of therapeutic nurse-patient relationship: pre-introductory, orientation, working, termination. In the simple word, pre-introduction means before starting the planning, setting of place, everything will do that. Orientation means we are going to orient to each other and we are going to collect all the information and data. And third one is working. Whatever you have collected data from the patient, based on that we have to plan and we have to implement in that phase. The last one is termination. So in that, we are going to end that our session and we are going to ask the patient for come for the follow-up. Next, we are going to see the therapeutic impulses and its management. So there are 5 types of therapeutic emphasis. One is resistance, transference, counter-transference, gift giving, and boundary violation. So first one is resistance. So by the name itself, we can identify that resistance means that patient is attempt to remain unaware of anxiety producing. It is a natural learned recollected to avoid of verbalizing or even experience troubled aspect of self. Patient don't want to share the information. So for this, what are the management we can do? We can be active listening. We can give a clarification what is the idea patient have. We can help the patient to become aware of what has been going in his mind. We can explore behavior to find possible reason, and we can maintain open communication with the supervisor. So these are the management we can provide if the patient having a resistance behavior. Next is transference. So it is an unconscious response of the patient in which he experiences feeling and attitudes towards the nurse that were originally associated with significant figure in his early life. What happened in this stage? The patient will show some unconscious response towards the nurses that is related to her earlier life. So this reaction can be harmful only if they remain ignored and examined. So what are the management we can provide for this? In this, no need to terminate the relationship unless poses a serious barrier to therapy or safety. If it is not creating any problem, no need to terminate the relationship. Nurse should work with the patient in sorting out the first from the present. So whatever first or whatever story the patient have, the nurse can talk with the patient and they can sort it out. Assist the patient in identifying the transference and reassign a new and more appropriate meaning to the current nurse-patient relationships. So these are the things we can do if the patient is having transferency. So next one is counter transference. So that is the opposite of the second one. In that, there we have seen that is about the patient feelings. Here it is about the nurse. So here what will happen? Nurse will think about the his or her first with the mixing with the patient. So it is opposite to the transference. So what management we can do? Need not terminate the relationship, support the nurse, assist her identifying counter transference, discuss with supervisor, self-examination, pursue to find out source of problem, exercise control counter transference, and fear consultation and professional meetings. So here also no need to terminate the relationship, just we have to make sure that the nurse can identify that she is going through this counter transference and she can discuss this with her supervisor and she can sort it out. So this is the third impulses. So next we are going to see the Next one is gift giving. So here it is about the things that the nurse can receive from the patient. So if the nurse is receiving any gift from the patient, what will happen? It will inhibit the independent decision making and create a feeling of anxiety or guilt. So that is also a one more things or one more emphasis. So what will happen? The timing of a particular situation, the intended of giving, the contextual meaning of the giving of a gift. The last one is boundary violation. We should not cross our limit. So it occurs when the nurse goes outside the boundaries of therapeutic relationships and establishes social, economic or personal relationship with the patient. That time it will create a problem. So with this we have finishes the impasses in the therapeutic management and how to overcome from that situation. So this is all about the therapeutic nurse patient relationships. Thank you guys.